And I love looking at my cases because I learn a lot. Now you're seeing a lot of awesome work these 2 days, a lot of motions. And I like to look, and I dip in kind of slowly. And this is one of my early motion cases. And I started with a case that is a unilateral class 2. You'll notice she's pretty socked in on the left. And on the right side, you'll see she's almost a full cusp on the canine, kind of heading towards full cusp on the molar. And so I put these on, and 2.5 months later, she comes in the clinic. I look and I say, whoa, that's interesting. But what happened? So we go looking. So this is an anterior cranial base superimposition, but I'm just showing you the teeth. Now she was symmetric in the mandible, which made it pretty simple, and she was pretty well aligned, which made it pretty simple. But I want you to look at what happens when we put the motion on this one side and look at the change relative to an anterior cranial base superimposition. So you notice the first molar and the canine are moving as a unit, as we'd expect, because they're locked together. But what's interesting to me is notice how much change is happening in the mandible. And that's interesting. She didn't grow in 2.5 months, that I know. But there's a lot of change there. But if you look at what happened in the maxillary buccal segment, notice how those teeth just kind of went back and down into their occlusion. There's something to bite jumping here that's very interesting to me. And again, it goes along that theme that I love, which is just nudging Mother Nature into place where she can do the things that we want her to do. As Luis talks about, the mandible moves, whole body. We're not getting instant growth in 3 months. So what's interesting to me is if I look at the T1 and T2 tomographic slices of the joint, you'll see that her condyle came out of the joint on the right side, and that's expected, and that's okay. What I think happens, and this is anecdotal, of course, what I think happens is once you jump that bite, even if the condyle's out a little bit, now the occlusion is your built-in functional appliance. And so now the body just starts to adapt. And I love to see that because, again, I'm just getting Mother Nature nudging her in the right direction. So this was about 3 months of a motion. She had like a month break before we jumped into braces, and then so she had just about 10 months of fixed appliances, and here's her final. Not a difficult case, but again, it tells me a little bit of what these mechanics do. So now as I get deeper into trying these appliances, I can start to see, oh, okay, that's what I can do with it. Oh, that's the change. Is that as good as the change I've had before? I can look at it and make really educated decisions.